Welcome dear viewers. So today let us discuss the anatomy of the middle ear. Middle ear is otherwise also called as the tympanic cavity. So coming to the location of this middle ear, it is located within the petrous part of the temporal bone. So this middle ear is typically sandwiched between the external ear and the internal ear. This middle ear, it communicates anteriorly with the nasopharynx through the auditory tube, and posteriorly it will communicate with the mastoid antrum through the adductors to mastoid antrum. So anteriorly it will communicate with the nasopharynx through the auditory tube, and posteriorly with the mastoid antrum through the adductors to mastoid antrum. This middle ear, it is filled with air and lined with mucous membrane, and it assumes its adult size by the birth itself. Coming to the dimensions of this middle ear. So the vertical diameter and epidiameter of the middle ear is about 15 millimeters each, and transverse diameter is 6 millimeters at the roof, 2 millimeters opposite the tympanic membrane, and 4 millimeters at the floor. So it is constricted in the center. So if you take a coronal section of the middle ear, it gives the typical look of a biconcave disc, just like a RBCs. It is constricted in the center and expanded at the peripheries. But if you take a section along the long axis of the petrous part of the temporal bone, it will give the typical appearance of a pistol. So with the auditory tube and the mastoid antrum together, it will give the typical appearance of the pistol. The auditory tube representing the nostrils, and the tympanic cavity will represent the body, and the mastoid antrum will represent the handle. So this middle ear, or otherwise called as the tympanic cavity, it has got subdivisions by the presence of the tympanic membrane. So let's have a look at the subdivisions. So subdivisions of the middle ear are epitympanum, which is otherwise called as the attic, mesotympanum, and hypotympanum. I told you it is divided by the presence of the tympanic membrane. So the part of the middle ear which is present above the tympanic membrane is called as epitympanum, and this lodges the head and anterior process of malleus and body and short process of incus, and the part which lies opposite the tympanic membrane is called as mesotympanum. Now this mesotympanum, it lodges the handle of the malleus and the long process of incus and stapes. Next, hypotympanum is the part of the middle ear cavity which is located below the tympanic membrane. So this middle ear, it is roughly cuboidal in shape. So it has got a roof, it has got a floor, it has got an anterior wall, posterior wall, medial wall, and the lateral wall. So this is the roof, this is the floor, this is the anterior wall, this is the posterior wall, and the wall shown here is the lateral wall. So the roof is wider in comparison to the floor, and anterior wall is smaller in comparison to the posterior wall, and both the medial and lateral walls, they bulge towards each other into the tympanic cavity. So this is how they look. This is the medial wall and lateral wall bulging into the tympanic cavity with the convexity towards the tympanic cavity. So now let's have a look at the boundaries of the middle ear. How the roof is formed, and how the other boundaries are formed, and what are the important relations. So initially, this is the roof of the middle ear. So this is formed by a thin plate of bone which is called as tegmen tympani. Tegmen tympani. So I told you this is wider in comparison to the floor. So this part of the bone, it separates the middle ear cavity from the middle cranial fossa. So that is the only demarcation between the middle ear and the middle cranial fossa. So why is it important is, in young people, this part of the bone, it is still unossified. So what happens? Any infection from the middle ear cavity can directly spread to the meninges. And in adults, what happens? There will be a patent, sometimes there can be a petrosquamous suture. So the veins from the middle ear, they drain into the superior sagittal sinus. So in such cases, what can happen is infection from the middle ear can spread into the intracranial dural sinuses. So that is the importance. And this roof is pierced by lesser and greater petrosal nerves. So that is about the roof, which is formed by the tegmen tympani. Now let's have a look at the floor. As I told you, the floor is less wider in comparison to the roof, and this floor, it is formed by the jugular fossa. Jugular fossa. So this is the under surface of the petrous part of the temporal bone, and this is in relation to the jugular bulb, that is the superior bulb of the internal jugular vein. So this is the superior bulb of the internal jugular vein. So the floor is formed by the jugular fossa. This floor is pierced by the tympanic branch of the glossopharyngeal nerve. So there is a small foramen which is present in between the jugular bulb and the lower part of the bony carotid canal. So this is the carotid canal and this is the lower part of the carotid canal. So there is a small foramen in between the jugular bulb and the lower end of the carotid canal, through which the tympanic branch of the glossopharyngeal nerve will enter into the tympanic cavity. So sometimes this floor, it is pierced by accessory mastoid air cells also. So that is about the floor of the tympanic cavity. Next, let's have a look at the anterior wall. So this is the anterior wall of the middle ear cavity or the tympanic cavity. So in the lower half, the anterior wall, it is formed by the posterior wall of the bony carotid canal. So this is the bony carotid canal. So this is the posterior wall. This carotid canal, it will lodge the internal carotid artery with its surrounding sympathetic plexus of nerves. So the lower part of the anterior wall is formed by the posterior wall of the carotid canal. And if you have a look at the upper part of the anterior wall, it is showing two bony canals which are separated by a thin plate of bone. So the upper bony canal is for the passage of the tensor tympani muscle, and the lower bony canal is for the passage of the auditory tube. So these two bony canals will form the upper half of the anterior wall. Now you have seen the lower part of the anterior wall is formed by the posterior wall of the carotid canal. So this is pierced by superior and inferior keratico-tympanic vessels and nerves. So till now we have seen the roof is being pierced by the greater and lesser petrosal nerves. The floor is being pierced by tympanic branch of glossopharyngeal nerve, and anterior wall is being pierced by superior and inferior keratico-tympanic nerves. And now let's have a look at the posterior wall. So this is the posterior wall of the tympanic cavity. So this is wider in its upper aspect. So it has got a wide opening in the upper aspect of the posterior wall, which is referred to as adductus to mastoid antrum. So this is the part of the posterior wall which communicates the epitympanum to the mastoid cavity, to the mastoid antrum. So this is referred to as adductus to mastoid antrum. And near the adductus to mastoid antrum, you can see one small depression which is referred to as fossa incudis. So this is a small depression which is present, and you see the short process of incus is suspended from the fossa by means of a ligament. So this is the fossa incudis. So the second feature which is present in the posterior wall of the middle ear. Next, you see this is the bony facial canal which lodges the facial nerve. So this extends up to the stylomastoid foramen, which is located between the styloid process and the mastoid process. So this is the vertical bony facial canal which lodges the facial nerve, and the facial nerve, after it passes through this bony facial canal, it will exit out of the stylomastoid foramen and it will continue its extracranial course. So the bony facial canal will form the one of the feature in the posterior wall. And if you see carefully, there is one small eminence in the upper part of the vertical facial canal. So that is referred to as pyramidal eminence. So this pyramidal eminence will lodge the stapedius muscle with its nerve supply. The tendon of the stapedius will pass through this small opening which is present over here. So in the posterior wall, we have seen the adductus to mastoid antrum, fossa incudis, and vertical part of the facial canal and pyramidal eminence. So the posterior wall is related to the facial nerve. So we have seen anterior wall is related to keraticotympanic nerves. Posterior wall is related to facial nerve. Roof is related to greater and lesser petrosal nerves. And the floor is related to the tympanic branch of the glossopharyngeal nerve. So the middle ear is so important that it is related to important vessels and nerves throughout its boundaries. Now let's have a look at the lateral wall of the tympanic cavity. So the part which is being shown here is the lateral wall of the tympanic cavity, that is the middle ear. So the lateral wall of the middle ear, it is formed by the mucus covered medial surface of the tympanic membrane. So beneath the tympanic membrane, you can see the handle of the malleus and the long process of the incus. So the point of maximum convexity which projects into the middle ear cavity, this is referred to as the umbo. It is called as umbo, the point of maximum convexity of the tympanic membrane. So the other feature which you see in the lateral wall is, you can see this is the cauda tympanic nerve. This is the cauda tympanic nerve which is passing over the medial surface of the handle of the malleus at the junction between the pars flaccida and pars tensa of the tympanic membrane. So in the anterior part of the, in front of the tympanic membrane, in the lateral wall, you see some small slit-like openings. So petrotympanic fissure, this is referred to as the petrotympanic fissure, which allows for the passage of the cauda tympanic nerve and to the anterior ligament of the malleus. So this part of the petrotympanic fissure through which the cauda tympanic nerve passes through is referred to as the anterior canaliculus of the cauda tympanic nerve. So posterior to this tympanic membrane, you have got one more canaliculus through which the cauda tympanic nerve passes. So this is referred to as the posterior canaliculus of the cauda tympanic nerve. So the lateral wall is also related to one important nerve, that is the cauda tympanic nerve. So now if you have a look at the upper part of the lateral wall, so you can see the head and anterior process of the malleus, and you can see the body and the short process of the incus. So this part of the lateral wall is formed by the squamous part of the temporal bone. So this is about the lateral wall. So the lateral wall also has got one important relation with the cauda tympanic nerve. Now let us discuss about the medial wall of the middle ear, that is the tympanic cavity. This medial wall, it faces towards the internal ear. It faces towards the bony labyrinth of the internal ear, and it presents these 6 features. So we will look at have a look at each feature. So first one is the promontory. So this is the promontory, which is a bulge which is present in the center of the medial wall, and this bulge, it is produced by the basal turn of the cochlea of the inner ear, of the internal ear. So this is a bulge which is seen in the center, produced by the basal turn of the cochlea, which is located in the inner ear. So if you have a look at this promontory, the tympanic branch of the glossopharyngeal nerve, which is piercing the floor, passing through the floor, it will ramify over this promontory to form the tympanic plexus in the middle ear. So the other feature which we see is fenestra vestibuli. So just behind this promontory in the upper part, you see a reniform, that is a kidney shaped aperture, which is called as fenestra vestibuli. So this is otherwise referred to as fenestra ovalis. And now this aperture, it is closed in the recent state by the base of the stapes and the annular ligament. And the other feature which we see is fenestra cochlea. So in the posterior and lower part of behind the promontory, we see a small circular aperture which is called as fenestra cochlea, or it is otherwise referred to as fenestra rotunda. So this is covered in the recent state by the secondary tympanic membrane. The other feature which we see in the middle ear is sinus tympani. So sinus tympani, this locates the position of the ampulla of the posterior semicircular canal. And the other important feature seen in the medial wall is oblique part of the facial canal. So we have seen the vertical part of the facial canal in the posterior wall. So the oblique part of the facial canal. So this oblique part of the facial canal will join with the vertical part of the facial canal. So the oblique part, it forms one of the feature in the medial wall, and the vertical part will form the feature in the posterior wall, through which the facial nerve will pass through and it will lodge the external genu of the facial nerve. And the other feature which we see is processus trochleariformis. So in the anterior wall, if you remember, we have seen two bony canals and we have seen a bony partition which separates these two bony canals. So this processus trochleariformis is nothing but it is derived from the posterior extension of this bony partition between these two bony canals. So it will have a hook-like process through which the tensor tympani muscle will pass through before it gets inserted into the anterior handle of the malleus. So this is the processus trochleariformis. So these are the features you see in the medial wall of the middle ear or the tympanic cavity. Let us have a look at the contents of the middle ear. So we have seen the boundaries, now we will have a look at the contents. So the contents of the middle ear are the three ear ossicles, that is the malleus, incus and the stapes. Then it has got two muscles, that is tensor tympani and the stapedius muscle. So this middle ear is related to four sets of nerves. So those four sets of nerves are the superior and inferior keratico-tympanic nerves. So these are derived from the sympathetic plexus which surrounds the internal carotid artery, which is located, which is related to the anterior wall. So then the tympanic branch of the glossopharyngeal nerve. So the tympanic branch of the glossopharyngeal nerve, it enters into the middle ear cavity through the foramen which is present in the floor. Then it ramifies over the promontory to form the tympanic plexus, and it exits out as the lesser petrosal nerve after it passes through the roof. And then the cauda tympanic nerve. So the cauda tympanic nerve, it is a branch of the facial nerve. So this cauda tympanic nerve, it carries the taste sensation of the anterior 2/3 of the tongue, and it gives preganglionic secretomotor fibers to the submandibular and the sublingual gland. And the facial nerve. So this is the facial nerve. The branches of the facial nerve within the middle ear are the greater petrosal nerve, nerve 2, stapedius and the cauda tympanic nerve. So these are the four sets of nerves which are in relation to the middle ear. So 6 sets of arteries supply the middle ear. So what are those 6 sets of arteries? So the stylomastoid branch of the posterior auricular artery, and sometimes it could be a branch of the occipital artery. And then the anterior tympanic branch of the maxillary artery, petrosal branch of the middle meningeal artery, and superior tympanic branch, again a branch of the middle meningeal artery, and branches of the ascending pharyngeal artery and artery of pterygoid canal. And the last set is the tympanic branches of the internal carotid artery. So these are the 6 sets of arteries which will supply the middle ear. So if we have a careful look at the middle ear, the anterior wall, some points of interest. So the anterior wall, it is related to a artery, it is arterial. The floor is related to the vein, it is venous. And the posterior wall, it is related to nerve, facial nerve. And the roof is pierced by the lesser and greater petrosal nerve. Anterior wall is related to the sympathetic plexus surrounding the internal carotid artery. And the floor is pierced by the tympanic branch of the glossopharyngeal nerve. Of course, in the posterior wall, you know, there is the facial nerve. And even in the medial wall, you have got the facial nerve, and the lateral wall is related to the cauda tympanic nerve. So these are some points of interest about the middle ear.